A meaningful talk. Ladies and gentlemen, we now continue with our next session of the day, Innovations and Access in Fertility Care, making IVF affordable, accountable and accessible. While India has seen a rapid expansion in IVF centers, the cost, information gap and social stigma continue to make fertility care out of reach for many. This session brings together leaders from healthcare delivery, financing, law, and entrepreneurship to ask the big urgent questions. How do we reduce the financial burden of IVF without compromising on quality? Can innovation and inclusion go hand in hand in reproductive care? What role do corporates, insurers, and legal frameworks play in shaping the future of access? And how can we bring more transparency and patient protection into the fertility ecosystem? May I now introduce and invite the panelists. Ms. Ojaswini Kapoor, CEO, Bloom IVF Group. As the CEO of India's leading IVF networks, Ms. Kapoor combines business leadership with a patient-first approach. Under her stewardship, Bloom has grown its footprint while maintaining a sharp focus on clinical ethics, trust, and transparency. She brings a strong understanding of both scale and accountability in fertility services. We also have Dr. Shweta Gupta, Director, Reproductive Medicine and ART, Max Healthcare. A senior clinical voice in reproductive medicine, Dr. Gupta is known for her excellence in IVF outcomes and her advocacy for evidence-based protocols. Her work at Max bridges both the clinical and systemic barriers that affect patient access, especially in complex fertility cases. We also have Mr. Sarvendra Mani Tripathi, partner Lex Curium, a legal strategist with deep expertise in healthcare, law, and reproductive rights. Mr. Tripathi brings clarity into the often grey areas of consent, liability, and compliance in ART. His insights help frame regulation not as restriction but as responsibility. We also have Mr. Sakti Prasad Menon, Executive Vice President, FIBE India. At the forefront of fintech and digital lending, Mr. Menon is helping design financial solutions that can enable more inclusive access to IVF treatments. His work explores how smart financing can support patient journeys and institutional models alike. We also once again have Dr. Vasundhara Jagannathan, Managing Director, Sri Chakra Fertility. As our moderator, we have Mr. Vikas Anand, co-founder and CEO, SafeTree. Having just introduced us to IVF insurance products, Vikas now returns as moderator, bringing together perspectives across business, law, healthcare, and finance. His position at SafeTree gives him a unique vantage point to lead this discussion on affordability, innovation, and responsible expansion in fertility care. The panel is titled Innovations and Access in Fertility Care, making IVF affordable, accountable, and accessible. Just allow us a couple of moments to set the stage and we will then invite all our speakers. May I request all the speakers to please join me on stage? And can we have a huge round of applause for everybody? And over to you, Mr. Anand, to moderate the session. Thank you.
Good afternoon, everyone. Fertility care in India has been evolving at an amazing rate. Medical advancements, the number of IVF clinics we have got, and also the acceptability of IVF has increased significantly over the years, which has given lots of hope to millions of aspiring parents. However, the challenges of affordability, accessibility, accountability still remains. Recently, there was a UN report which said the decline in the fertility rate has been much more than many of the experts would have stated. So it's very, very important that we need to have a complete discussion. How can we bring innovation, accessibility, and also accountability in this process? And in this, we have an esteemed panel with us, and we have panels from clinical excellence, law, finance, innovation in healthcare, and we'll try to talk about ways how we can redefine the future of fertility. And I'm hopeful of we are able to come up with lots of discussion, useful discussions. Starting with Ojaswini. Affordability is a big, big problem. We have talked about it. If you could just explain us how the operational and clinical innovations at Bloom have helped reduce the cost and expand access without compromising on the quality.
Sure. First of all, I'm really happy to be here in this August gathering, and thanks to ISW Council for organizing this. My question is specific to Bloom IVF, how we are, tackling this problem. And our group headed by Dr. Rishikesh Pai and Dr. Nandita Palshetkar has been, focused on providing access to IVF since more than 30 years. Now, there are two parts to it. One is operational part and one is the clinical part. So operationally, of course, there is one very important thing that we have done, that is hub and spoke model. So not all the centers of ours are IVF. This is how many chains are operating. So suppose there is a spoke center in tier 2 or tier 3 city, and a very connected city, tier 1 city has the IVF center. So that is how we are reducing the cost and increasing accessibility for those patients. Second thing is digital counseling and telemedicine, which actually after COVID has really expanded. So that helps in patients not needing to come many times. Of course, they have to come for monitoring. They have to do all that. Monitoring can happen in their areas also. So that is another thing. Now, when we come, so this is more of like management and operations. Now, clinically, how the doctors are, of course, all the doctors here will explain it better, but just in a short brief, one is that we have mild stimulation protocols. We try to use that. We use antagonist protocols nowadays. So that helps in, reducing the cost for the patient. Then things like we have batching system. That is very important. That is how we are reducing the cost. That suppose there is a tier 2 and tier 3 city where we have a center. So we don't do IVF cases all the time there. We batch them into, within a week or within 2-3 days. So that is how we save the cost. Then technologically we have AI, we have embryoscope. So how that helps is by increasing the success rate, we are decreasing the cost of multiple IVF cycles for the patient. So that is also one way that we look at. And there was, I think, one more point, which I'm forgetting now, so I'll add it later.
No, that's extremely useful. Mr. Menon, many young adults in India cite financial limitation as a major barrier to starting a family, and traditional health insurance, they don't cover about IVF. From a fintech and financial services standpoint, how can innovative financing solutions help IVF affordable? And what role can financial industry play in ensuring hopeful parents aren't turned away from the treatment due to the cost?
Thank you so much, and good evening all. Coming back straight to the point, we all were discussing, and even in the previous panel, and this is a very recurring discussion that happens in this space. How do we bridge the gap between what they want and what they can afford? right? So definitely what they want in this common discussion is to become from a probable parent to a parent and have another person added to the family. But what we have seen while we have been working in this industry is that there's a huge gap in the understanding. The moment people think about affordability, it becomes like, hey, I have to take a loan. And taking a loan itself is a burden. And already people walk into this decision after a lot of mental stress. And then after a lot of mental stress and then another loan, it kind of creates a difficulty burden to the probable parents. And what, as a lending company and a fintech company, we do in this space is to eradicate that process of having another mental block. So why are we here is because we are as strong as the partners we work with. So today I take a pride that we work with a lot of large IVF chains in the country, and we've been able to co-create programs with most of the chains, where rather than it looks like a loan, we create it more like a program. And it's not like look. When I say look, it looks like a very fabricated word, but we actually mean it. So when like what ma'am was saying, when they walk into for a counseling, we make it part of the counseling, which says that, hey, rather than you spending a lot of investment on day one, why don't you make the treatments into a differential plan? Or rather than going for a single cycle procedure, you can split it into multiple procedures. And one of the coupling question that you have had is on the limitation of insurance. Today, either you need to be employed with a large corporate to have that insurance, or else you don't have that. So I still remember last year, one of the agenda that we took away from this session was, we will work towards it, and I'm super proud. Yes, SafeTree is one of the partners, and also we are working very closely with few insurance companies in this space, and we have also co-created a lot of products which could cover all the cycles, and the IVF chains definitely don't have to compromise on the profit part of it, and the second, the patient also doesn't have to burn his pocket. So this is how we have been trying to bridge that gap. And as I said, when we work together as a fraternity, the insurance companies will someday have to get into the space where they can also, bring in more innovation to bring this. Today, there's no regulator who's asking it, so that it's spread across. Nobody wants to take the ownership. So I think with SafeTree also being part of this scope, insurance and affordability and the science behind it, definitely I leave the doctors to talk about it. Science come together, it becomes a much better prospect for the people or the probable parents.
Can I just make a concern over here from a clinician's perspective? Because, see, whenever there is an insurance discussion that happens, especially where patients are there, they might be in their 33, 34, but then we see patients with decreased ovarian reserve. Or, nowadays the marriage age is like, getting married itself at 38, 40. And insurance cover, if they take, I presume there is a waiting period. So are we really, doing justice in, giving insurance, because their biological clock is anyway ticking and they're already in that pressure. And somehow I think we have to work on the waiting timelines is my sincere suggestion. I'm sure you must be working on those lines, because this is the need of the hour, basically.
100% agree, and today we are launching few products which does cover a reduced waiting period. So an attempt has been made by SafeTree to get similar kind of a product, but can I have a product with zero waiting period? That won't be possible. Insurance is a risk mitigation tool. It's like similar to wearing a seat belt or a helmet, that in case there is an accident, my ability to mitigate the loss is reduced. So it can't be something of once the accident has happened, then I go for it. So definitely we have come up with the products with much lower reduced waiting periods, but asking for a product which doesn't have a waiting period from an insurance industry perspective won't happen.
Yeah, that's quite good that you're bringing out at least a shorter waiting period. More important would be like how he was saying that he's collaborating with other partners or employers to give benefits to the employers. Everybody getting included, all the MNCs coming together, so that then they have their reproductive autonomy. Exactly. That is more important, and that work.
I just wanted to ask, I think nowadays the corporate are also covering some of the IVF procedures, isn't it?
Yes, ma'am. So,
Yeah.
like I said, that again limits the democracy. So today, what's happening is that people who works with a Google or a PayPal would be able to afford it, versus someone who is working in a smaller company is not able to get that. So how we are bridging that gap is working with the TPAs or the companies providing insurance, saying that we should add it as part of the package, or else we plug it as an affordability suite, so that the day they join the company, it becomes a part of their joining benefits.
I think the biggest challenge is, the mindset and the lifestyle. I mean, I work in South Delhi in Mac, so, they are all having money. That's not the problem. But they have come so late that, the requirement, the cost, the add-ons, everything, because as a clinician, I want to get her pregnant. And she can afford. This is how the younger generation is. In fact, they all are coming for egg freezing also. But which is good, but not all. Last couple of years, I think we have seen this change, that they're getting awareness from their friends and also they're coming. But they come so late, that lifestyle, that the cost is at that point becomes very secondary. I think that awareness has to be there, but that's about the, the well-off people. Of course, the other part, of course, if you go to the tier 2 and tier 3 and the small, the people who can't afford much, where there is a problem, of course, the affordability is a problem. And ultimately, whether you are rich or poor, you do look at the cost also. Yeah.
True. Along with the affordability, ma'am, you rightly said, it's the awareness problem. I think there has been discussion. We need to make couples at the start of they getting married. A child is an option. They want to defer it, but there are means available, like you rightly said, egg freezing, insurance is coming up. So these kind of things, we need to make them aware.
Yeah, access is not equal to affordability. I think it is the awareness, it is the acceptance, going to grassroots levels in the villages where there is a lot of taboo and misconceptions, and then getting out. They also might need egg freezing. They also need all those. We need to create that equality amongst the segment. So accessibility is not equal to affordability, and it's probably we should ask the patient. Nowadays, it's a common statement: I can't afford IVF. It's not about affording, it is about whether you're feeling safe throughout the journey, whether the entire system is transparent, whether you're explained your individualized success rates, and whether you're emotionally supported through the journey. I think everything is important in accessibility to fertility care.
100%. Transparency is very important. There was an article by one of the magazine, Ken, which talks about the lack of transparency within the ecosystem. So we will talk about that. You rightly said that. Mr. Tripathi, how are the new ART and surrogacy regulations shaping affordability, transparency, and ethical practices within the IVF sector?
See, I think I thank you all for inviting me here. I think the affordability question is answered by Ojaswini ji. I think that is the best answer I found. However, the transparency and other thing are there. So the consent management platforms, the consent management regulations, ART regulations, and surrogacy regulations, all are there. These regulations are providing confidence to the people also, so that they think now they are knowing it, like this is the good way to do things in that way. And the other transparency part, for the because of counseling and other management systems which are being introduced by the ART and IVF clinics. So these are also added with ART and surrogacy regulations, which are supplementing all these questions.
This is promising. One of the things, preamble of these regulations was to bring transparency, and I'm very pleased to know that this is working.
Yes.
So can I just add?
Yeah, sure.
So I think obviously last, since the law has come to India, so the registration part has definitely, all the registration is there. But even now, we don't have those performance, KPI, the honest statistics which we have if we compare to HFA or if we compare to the Gulf countries or US. I think that is still maybe because it's in early days. So the transparency is still not complete. Yeah, it is up to the stage of getting the registration, but not on the results. So the patients wants to know the results as well, how good or how competent that IVF center is. Otherwise, everything is equal.
Exactly.
So,
Sorry, can I add one question actually to you only, ma'am? Actually, while I was reading few months back about some study, so what they were saying, like HFA and all, they display their results, online.
very honestly.
But they also mentioned that because of that, what is happening is that sometimes poor responders and patients who have repeated IVF cycles, the clinicians are not ready to take them, because what will happen is they know that the success rate might decrease.
So the statistic is made on the basis of some, categories, less than 35, more than 35. So you can actually go into much detail. If you are a thorough, if you want to see the statistics, then it is divided on the basis of age, category, you can divide it in different. So there are some standard performance indexes to check the embryology team, to check the clinicians, which is followed. I think probably in few years we will go that far, and each center will have to do an annual reporting of some sort where they will send this and maybe keep
I
it.
believe many things comes through competition. So the government may not be fully onboarded to these extent of KPIs. I think the more market awareness, more customer awareness, and the competition rises, this will be one of the things everyone would be asking about. So it's the way any market has evolved, and I feel infertility market is no different from anything else. With you, ma'am, Dr. Gupta, from a clinician standpoint, where do the real cost inefficiencies lie, and what solutions are workable without compromising on outcomes?
So from a clinician, I want to get her pregnant, and if possible in the very first attempt, so that, the overall, as Ojasvi also saying, overall cost will definitely reduce, because why does she need 3 cycles if you can give the best result in the first? But sometimes, so in that, when you want to give or reduce the time to the pregnancy, you have to individualize. So from the clinicians, of course, the cost is important, but at the same time, how I can give the superior result. That is what and of course, that is where the excellence or the expertise of clinician is, that at the same time you have to keep the cost less. So sometimes people think that, as we discussed in the previous panel, okay, give her 450 dose, a high dose. It doesn't work like that. You have to individualize. Sometimes the minimal stimulation or the moderate one, even with 300, so you actually reduce the cost. So your knowledge, expertise, you must be at par with what is the latest standards, guidelines, the different ASHRAE, or even, the different guidelines of ASRM. So one needs to keep updated, but yes, you can reduce, like the right kind of, injections,